Hey there, it's Dr. Tummala from Trinergy Health again. I am actually attending my first ever MAPS conference, which is the Medical Academy of Pediatrics and Special Needs. And today I have with me Dr. Ari Calhoun, who is a naturopathic doctor and who specializes in maternal fetal health and helping children and adults with neurodevelopmental disabilities. And we found out that Ari actually is from Wisconsin. Yeah, what a small world. But you're now practicing in California.
Yes, in San Diego.
In San Diego, okay. So tell us a little bit give us your background.
Yeah, so I'm a naturopathic doctor. I actually never saw myself going into neurodevelopment, but I started working at a clinic that was brain-based. I did a lot of mental health, and I was the only clinician who felt comfortable treating children. So naturally, I came into this world where I started seeing more and more children with neurodevelopment disorders, and I fell in love with it. I have debated doing other ventures with my career, but I honestly cannot leave one-on-one care because there's nothing that is more rewarding than seeing a child really meet their potential, and parents and families, seeing their child come to their full self and healing. And so,
wait a minute, you're actually saying that autism and developmental diseases can be healed?
Yeah,
really?
Right? No, surprise, because it's genetic only, is what we're told.
Yes. Yeah. But you and I, we're not doing what we are told.
We're breaking the rules, and we are treating this as a medical disorder, a chronic health condition that's multifaceted
and affects the whole body.
And I truly believe, there's definitely different amounts of progress you can get depending on where you start in life and where they are in the stage of neurodevelopment. But I have seen countless number of kids lose their diagnosis over time, which just gives me so much, joy. And more than that, it's not just a label. We don't like labels. I think we both established that. But it's about seeing that the child is functional, they're happy, they're at peace, and the family is as well.
They're at their best potential. Yeah. Yes, no, I completely agree with that focus and with that goals. Now, you are presenting tomorrow, so what is your topic?
Yeah, so I get to talk about my favorite subject, and that's really maternal risk factors in neurodevelopment. And specifically, I'm going to be speaking about immune-mediated risk factors and inflammation, but it is really more broad than people think. It's not just autoimmunity or infections, but immune activation or inflammation occurs with a whole host of metabolic conditions, psychological conditions, toxins, stress, gut issues, and so,
Sorry, okay.
No.
I was about to say, and all of these are potentially modifiable.
Yes. 100% potentially modifiable. And what I'm super encouraged about as a physician is that even if we're in the midst of the pregnancy and we are going to encounter infections, we cannot resolve everyone's autoimmunity prior to pregnancy. I know I have an autoimmune disorder. My autoimmune disorder didn't go away. It went into more of a remission state. But even in the midst of these perturbations, there are things that you can do to protect the fetal brain. And that is what's so encouraging.
So really, you're talking about prevention.
Prevention, yeah.
And people that have followed my blogs, this is exactly what I've been talking about. Because if you understand the root causes for any disease, whether it's autism or ADHD or schizophrenia for that matter, we understand it as the immune activation. And of course, with neurodevelopmental diseases, the immune activation is actually happening in the mother. There is a contribution even by dads. I've looked at studies where paternal exposure to antidepressants or other medications has been linked to a higher incidence of autism and developmental disorders, behavioral disorders in the offspring. But yes, as women, we bear the children for 9 months and we give our cytoplasm and our mitochondria to our babies. So we do bear a little bit more responsibility in this issue. But everything that you're saying is so parallel to my own evolution into a holistic psychiatrist. And yes, the thing that gives me hope and joy is that I know that we can prevent these conditions.
I truly do believe that. And that's what I'm so excited about, speaking on this and getting the word out so that it's more common knowledge. First off, what the risk factors are. So we can't prevent what we don't know. And that's what's so discouraging. I hate, it really is hard to do this perinatal history with families and hear from the parents, I wish I would have known. I don't want any family to ever say that. I want this to be common knowledge, but also know that we are going to all encounter risk factors, so we can't walk around in fear our entire pregnancy.
Yes.
But what can we do in the midst of encountering one of those risks?
Yeah, and that's exactly why I'm doing this podcast, why I started all my social media channels like you. You have a social media presence as well. We are doing this because the more people we reach with this information, we are hoping to empower everyday men, women, and even children to take their health into their own hands and to really become informed consumers and decision makers of their own health process. So my next question for you is your 3 pearls of wisdom for our viewers.
Yeah, great question. Okay, so because I'm so focused on prevention and maternal and fetal health, I would say, I'm just going to leave it there and kind of focus on the 3 most important things I think about there. So number 1, I think preconception is this incredibly important time that we should all be thinking about, if we can. Now, I got pregnant with my first unexpectedly. And so you take it as it is, right? Like those things happen. But in the event that you are trying, you have this beautiful time in the year ahead of time to prepare your body, to get your body in the healthiest state as possible. Because your womb is the environment. So with that really entails looking at your immune system, where your inflammation is, what, modifiable risk factors you can control when it comes to your immune health. It looks at toxin exposure, and there's so many amazing tests now to really help you analyze that. But just by doing what you can, recognizing that there are toxins in our environment more now than ever before, taking small, tangible steps to reduce those. And then number 3, I would say, is nutrients. And so I actually also work for a company. We develop prenatals, and I'm very fascinated with the research here, and we are seeing nutrient deficiencies in pregnant mothers more than ever before. And why is that? I think it's a big part of it is just because of the quality of our food has gone way down. The soil which we grow our food has gone way down. So we oftentimes, even when consuming a really healthy diet, could use extra supplementation to kind of fill in those gaps. And so I'm very passionate about getting on a comprehensive prenatal that has good forms of nutrients, has methylfolate in it, has methylcobalamin, has the right forms of nutrients that aren't going to cause further oxidative stress. And just really thinking about creating, you are the environment. Remember that everything you are doing for yourself is creating the environment which within your baby is going to grow. And that is not just their brain health, but that it's their immune health, it's their gut health. You're the chamber. And so, we just want to kind of clean that up as much as possible.
Absolutely. And dads, this is not a free pass for you. No. The health of your sperm is also very important. Detoxification is very important for men as well, because with the exposure to all these environmental toxins, many of them that are endocrine disruptors, in the last 70 years, and pay attention, in the last 70 years, we've seen average sperm count go down by more than 50%. Sperm motility is also affected, which means that the mitochondria that power your sperm to swim faster and get to the egg faster and in a healthier state, that is getting affected, and it's mostly to do with the toxins. So dads do have an important role.
100%.
And epigenetics
too.
Epigenetics,
right? Absolutely. Dads have an important role, and I mean the rates of infertility are on the rise, and a lot of them are male factor now. And genetics, infertility does really coincide with what we're seeing from a neurodevelopment side as well, because many of the risk factors are the same.
And again, these are all modifiable risk factors. Nutrient density, reduce your inflammation, especially in the gut-brain axis, and detoxification. And as we were discussing, as a holistic psychiatrist trained in Ayurveda, I am in love with Panchakarma, which is actually the only oil-based detoxification process that we have. And because all of these toxins, chemicals that we are exposed to, from glyphosate to phthalates and parabens, they're all petrochemical derived, meaning they're fat soluble. So you need the medium of fat to expel these toxins. In fact, in my practice, I routinely encourage my new moms and dads, even before they're thinking of pregnancy, I put the seed in their mind that they need to enhance their nutritional status, reduce inflammation, and do panchakarma. Both
Which
moms
is
and dads
great.
should be doing that.
Yeah, and if that's incredibly important that you're, again, doing this in the preconception time period,
Yes.
because once you get to pregnancy, you can't detox, unfortunately, but you can still avoid environmental exposure. So
Yes.
the work is not done. There's still a lot that can be done in pregnancy from a toxicity standpoint, but the preconception time period is such a sweet spot.
It is the time to intervene, actually. In today's world, I mean, I think 100 years ago, we didn't have to think so much.
Oh, no.
100 years ago, we didn't see the rates of autism and other developmental diseases that we are doing. These are not genetic diseases. Genes don't change in a matter of few decades. These are all environmental conditions, and we really need to look at the environment and take that power back. My last question for you, Ari. Where do you see MAPS going? What do you predict the trajectory is going to be?
Well, on this kind of line of thought, my hope is that we're all here today because we treat children with autism, or a lot of individuals here have a family member who is now struggling with a neurodevelopment disorder, and they're wanting to understand more about how they can help their family member. However, I think just this conference, we are starting to go into that maternal world and think about prevention, and that would be my hope. And my hope is that really we're getting prenatal care providers here, we're getting OBGYNs, we're getting midwives, we're getting people that are working with women in this crucial life stage that can recognize their role in intervention, and and I think this is so important. We think about the health of the baby based on, like, does it have all 10 fingers and all 10 toes? Is there any sort of huge developmental abnormality? Are they born with a good APGAR score? But that's it. And I really hope that we're now taking neurodevelopment into that consideration throughout pregnancy.
That is amazing. I think that gives me a lot of hope. In fact, I would say that just like we do the well child visits for children from ages 0 to 18 or 20, as the case may be, and in these well child visits, we, especially for teenagers, both teenage boys and girls, we need to talk to them about their reproductive health, not only in terms of preventing cervical cancer or those kinds of things, but also really talking to them about their reproductive potential and how they can enhance that aspect of their life, the sexuality and the reproductive, because as beings, as life forms, we all have a primal need to reproduce and pass on a genetic material. So it becomes really important, and I agree with you. I'm very happy to see the number of pediatricians here, but this message also needs to go.
Yes, no, I think pediatrics, I never even thought about that, but that's a great idea to begin this messaging and awareness in that teenage children.
Yeah. I mean, because let's face it, teenagers are the ones, especially teenage girls, are wearing a lot of makeup, perfumes and deodorants and antiperspirants, even boys too, it becomes important for them. But then, the junk food, the Skittles. I think most teenagers may outgrow Skittles, but the artificial dyes, the artificial flavors, and pizza becomes the primary source of nutrition for teenagers and young college adults. And all this information can be shared with them. So thank you for listening to us, and please share this video far and wide. We are here with the aim of preventing autism and other neurobehavioral conditions. Thank you.
Thank you.